Friends, in this part, I would like to discuss with you about the heart attack in more detail. This is all based on the information collected from different authentic sources, as I am not a doctor. About 8 months back, I released two videos on the heart and heart diseases, part 1 and part 2. In part 1, we discussed in detail about the structure and functioning of the heart, and in part 2 about the various heart diseases, the rheumatic heart disease, the fainting, dizziness, the palpitation, sinus, the tachycardia, heart block, heart failure, etc. And also the tools that we make use of in identifying these heart diseases. See, the heart attacks are becoming increasingly common. Increased awareness among general public and preventive measures have to be adopted to avoid this, as most of the victims are at their peak of productive life. See, heart is an organ which continuously pumps the blood into various parts of the body to supply the oxygen and other nutrients which are essential for the sustenance of life. And the heart itself depends on two small blood vessels to get its requirements of oxygen and nutrients through blood. So these blood vessels are known as the coronary arteries. So with the aging process, small cholesterol or say the fat deposits occur in the walls of the vessels, and gradually the vessels become thickened, hardened and narrowed. Certain factors make the change to occur earlier and faster. So these are known as the risk factors. They are the tobacco smoking, the high blood sugar, high blood pressure, BP, high cholesterol in the blood. So it can be overweight or the obesity, the sedentary habits, hereditary factors, the mental stress, etc., etc. So coming to tobacco smoking, the smokers carry 4 to 5 times, greater risk of developing the heart attack than a non-smoker. The nicotine, carbon monoxide, and other poisonous substances in tobacco, they cause damage to the vessel wall. It increases the BP and also increases the fatty acid level in the blood, all leading to the enhanced hardening of the vessels, what we call the arteriosclerosis. They also increase the heart rate and cause irregularity of the heartbeat, which can lead to the sudden death. So even passive smoking, that is standing by the side of a smoker, is considered equally dangerous. So smoking BDs, cigars, pipes, they are as bad as cigarette smoking. Even chewing tobacco is, as well as using the snuff, they are all considered as most harmful. So increased level of cholesterol or the fat in the blood, it also increases the incidence of hardening of the arteries and thus increases the chances of developing the heart attack. See, though the level of total cholesterol in the blood is important, it is more important to know the level of different types of cholesterol. Mainly, there are two types of cholesterol which are concerned with this hardening of the blood vessels. So they are the LDL and the HDL cholesterols. HDL is a good cholesterol, LDL is the bad cholesterol. So therefore, increase in the LDL fraction, it increases the fat deposition in the blood vessels, whereas the increase in the HDL fraction, the HDL segment of the cholesterol, it reduces the fat deposition. So LDL cholesterol level has increased on account of the excessive consumption of fats derived from the animal sources. It also increases the chances of the vessels getting hardened, getting blocked, and even taking cream of the milk, butter, ghee, ice cream, the yolk of the egg, organ meats, the shellfishes, coconut oil, they are all equally bad. The vegetable oils like the ginger oil and the sunflower oil, which contain high level of unsaturated fatty acids, they are preferable. And this HDL cholesterol, that is the good cholesterol, is increased by regular physical exercise, increasing the level of HDL cholesterol. It protects the heart. High blood sugar, or say the uncontrolled sugar, It also has been shown to accelerate this blocking of the blood vessels. In addition, the uncontrolled diabetics, they tend to be overweight and they have high cholesterol, all of which further increase the risk of the heart attack. High BP, or say the poor control of the BP, tends to increase the deposit of fat in the blood vessels. Not only the coronary blood vessels are affected, but also there is increased incidence of damage to the blood vessels of the brain, leading to the stroke, and damage to the kidney blood vessels, leading to kidney failure. So high blood pressure also tends to the enlargement of the heart. And coming to overweight, the incidence of heart attack is high in individuals who are overweight. So the excess of weight is usually due to too much of rich food, that is rich in fat and sugar, and too little of exercise also is one of the reasons. So this leads to the increased cholesterol in the blood and also the increased incidence of the atherosclerosis. Sedentary habit. It's a well-known fact that physically active people like athletes, they have less chance of developing a heart attack. Equally well known is that a sedentary person, he has a higher chance of getting the heart attack. So sedentary habit leads to the deconditioning and the obesity and also less burning of fat, leading to high blood cholesterol. And the emotional stress and the stress, because it can also enhance this hardening or blocking of the blood vessels. Individuals who are always tense, aggressive, and who would like to achieve things in a hurry, they are more prone to the heart attacks. So these individuals, they are known to have a type of behavioral pattern. So a person who is, calm, philosophical, and takes things in its stride is known to live longer. And the women, they are normally protected against the heart attacks till they attain the menopause. However, this protection is lost if they use overall contraceptive pills for a long time and if they smoke tobacco. And if anyone in their family had a heart attack, especially at an young age, so the chances of an individual in that family suffering a heart attack is also high. So such individuals should avoid the risk factors like smoking, sedentary habit, and the high fat intake. They should start their periodic checkups at much earlier age. So the process of hardening of the blood vessels, it can start as early as 15 to 20 years of age also. So hence it is important to start the preventive measures at an early age. So even the children should be taught about the ill effects of the various risk factors right from their early school days. Then what is the heart attack? With the progressive hardening and narrowing of the coronary blood vessels, the blood supply to the heart muscle, it starts diminishing, and as long as the blood supply is adequate to meet the demands of the heart, an individual will not have any symptoms. Initially, the blood supply may be adequate at rest, but it becomes inadequate during the activity. So the demand of the heart for oxygen, it increases with the activity when you are in work, when you are working. So this inadequate blood supply leads to chest pain. So the pain disappears soon after the activity is stopped. So this is known as the angina. The chest pain is usually over the center of the chest, feels like tightness in the chest, comes on exertion, and it is relieved by rest and lasts for a couple of minutes. So a small blood clot may suddenly block this narrowed blood vessel and totally obstruct the blood flow to the part of the heart. So this total stoppage of blood circulation, it leads to heart attack and it is called the myocardial infarction. The pain is more severe, lasting for nearly an hour or more, and usually associated with sweating and also breathlessness. So if the damage is very severe, it may lead to stopping of the heart and sudden death also. So if the pain is mild and subsidises with rest, please consult your doctor at the earliest. If the pain occurs during activity, stop the activity and sit and rest till the pain stops. If the pain is very severe, rush to the nearest hospital urgently. So the incidence of sudden death, it is very high in the first few hours after a heart attack, and many of them could be prevented or successfully treated in the hospital. So don't postpone seeking the medical help. Nowadays, a drug is given to dissolve the clot which has blocked the blood vessel. So this treatment is effective if given within the first 6 hours of the heart attack. So the treatment is, it is known as the thrombolytic therapy. Thrombolytic therapy, it has been proved beyond doubt that all over the world, this therapy, namely the thrombolytic therapy, given promptly reduces the damage to the heart and it hence reduces the complications of the heart attack. So this therapy, it makes it all the more necessary to reach the hospital in the shortest time possible. So the block in the coronary artery leading to heart attack, it can also be opened by a balloon and it is called as the balloon angioplasty and stenting, saving the heart muscle and its function. So this mode of treatment is known as the primary angioplasty or the direct angioplasty. If you see a person stricken with a heart attack, laying unconscious, give a hard thump on the chest and give mouth to mouth breathing and summon the medical help. And if you have a heart attack, you will be admitted to an intensive care unit, you will be attached to a monitor and the oxygen given to you. You may hear a lot of beep sounds and see many men and women in white coats moving around you, so don't panic. An injection will be given to calm you and sedate you, and after about 2 days of such an intensive care, you will be shifted to the wards where you will make a gradual recovery. So your activities will be gradually increased, and if there are no complications, you will be back home with your family in about 10 days. So your heart condition will be assessed often by various tests like the echocardiography and the exercise test before you are discharged from the hospital. This will help in planning further management of the heart. Some of the guidelines to be followed after a heart attack, or like this. During the first week at home, you should continue light work as you were doing when you left the hospital, when you were left for the hospital. And to live in the ground floor bedroom with toilet facility is ideal. However, if you live on upstairs, climb stairs slowly and if possible once a day only. Use the commode if toilet facilities are not available in the same floor. And in the second week, you should gradually increase your activities. You may climb one flight of stairs twice a day or walk about inside the house freely as you like. By third and fourth week, you should be able to undertake the light household activities. So physical activity should be gradually increased as the weeks go by. So those patients who have been physically, inactive prior to the heart attack, they are encouraged to become more active and to take regular exercises like walking, gentle jogging, etc. Those who have been practicing yoga may restart after the second week. However, sudden and severe form of physical extension or physical exertion, exercise, like your football, weightlifting, bull worker exercise, pushing a car, etc., must be, weightlifting, etc., should be avoided. Outdoor physical activities, they are best avoided in the cold and windy weather. Your physical exercise program will be advised after an exercise test by the doctor. So many patients, they find a benefit from a nap, means a slight sleep in the afternoon. So if you don't get good night sleep, a sleeping tablet may also be given to you. However, don't make a habit of this. Coming to diet, if you are overweight, you put extra strain on the heart and you should lose weight by going on a low calorie diet. So avoid fatty foods, butter, ghee, fatty meal, etc. Avoid the coconut preparations and the coconut oil for cooking as it has high contents of cholesterol. Oils containing the polyunsaturated fats For example, the sunflower, it can be used for cooking. Avoid the heavy meals. So evening meal is preferably taken a couple of hours before your bedtime. Avoid regular intake of alcohol as it will add to your calories and it also is harmful to the heart. And if you were a smoker before your heart attack, then you should give it up. This is crucial in preventing further narrowing of the coronary blood vessels. So many patients with light office work should be able to return to their previous job by 2 or 3 months after their heart attack. So those who were doing hard physical work may have to look for lighter work. There is an opportunity to reassess your responsibilities and consider reducing some of them also. If you are advised not to drive the vehicle for some time after leaving the hospital, don't do that. When you restart, try and avoid stressful situations such as rush hour traffic, etc. And coming to the sex life, sex can best be avoided for about a month after leaving the hospital as it puts extra strain on your heart. However, as your physical health improves, no undue restrictions are necessary. Coming to drugs, you may need to continue on drug treatment following the heart attack, often to provide the protection for the future. The hospital specialist or your family doctor will definitely advise you regarding this. So these are the rough guidelines. Your doctor is the best just to advise you regarding these matters. So what investigations your doctor may do when you have the chest pain is you seek the medical advice after taking the details of your illness and a thorough examination. Your doctor will take an ECG. He will ask for certain blood tests to check your blood sugar and cholesterol level to confirm or negate the existence of heart disease. He may perform a stress test wherein you will be made to walk on a treadmill or pedal a bicycle and ECG is taken during the exercise. And similarly, an echocardiographic examination may be done to assess the function of your heart. Sometimes a special scanning may also be requested to know the pattern of blood supply to the heart. So if your symptoms are severe and do not respond to the medications, or if the above test suggest the presence of serious heart problem, then you will be advised to undergo the coronary angiogram. So this requires hospitalization for about 24 hours under local anesthesia. A small tube is inserted into a blood vessel in the thigh and advanced towards the heart. So through this tube, the pressures inside the heart will be recorded. Blood samples are taken for analysis and a dye injected and pictures taken in a 35 mm cine film. The procedure will last for about an hour. Later, you can see the films with your cardiologist and discuss your problem. So, depending on the severity of the problems, you may be advised only to take the medicines or may be advised to undergo the angioplasty or the bypass surgery. So, don't lose heart. Even after a heart attack, you can lead a healthy and productive life. Even after a heart attack, taking preventive measures and avoiding the various risk factors, one can prevent further damage to the heart and prevent further heart attacks. So, by and this can be corrected by various new methods of treatment that are available now. Well, you have a choice. You can take preventive measures either before the event occurs or start it after the event, but prevention is always better than cure. So stop smoking and make others to stop too. Get into the habit of regular physical exercise, avoid fats derived from animal sources, reduce your weight, control your BP and blood sugar levels, get periodic checkup with your doctor, especially after the age of 40 years. So these are some of the preventive measures that you can take to lead a healthier life and to keep your heart healthy. So thank you very